So it's important if you are suffering from acne or if someone you know is suffering from acne, get it addressed and get it treated early so that you do not have to deal with the scarring at the end of the day.
Good morning, Dr. Kwan, better known as Zhenli, and I am Deborah. I am a consultant gastroenterologist and hepatologist from the University Kebangsaan Malaysia Medical Center. And today we are here to talk about a topic called acne, which is dear and near to both of us. So would you like to introduce yourself, Zhenli?
Hi, Deborah. Good morning. My name is Dr. Kwan, and I work in the University of Malaya as a consultant dermatologist. We've known each other for a long time. And so today we're going to talk about acne, which is something that's very common.
Indeed, it is. So can you tell us a little bit more, Zhenli, what causes acne?
All right. So as we know, acne is an inflammatory skin condition, and there are four main factors that cause acne. So firstly, increased sebum production. All right. And secondly, you have keratinization at the follicles, and that causes your blackheads and your whiteheads, all right, also known as comedones. And thirdly, there is colonization by a bacteria called Cutibacterium acnes. And this used to be known as Propionibacterium acnes, and the name has changed, but the role is pretty much the same. And lastly, because of all these factors, you get inflammation around the sebaceous glands and your hair follicles.
Oh dear, that sounds nasty. So can you tell us about the types of acne that exist?
So basically, the acne lesions can be divided into two types, either the non-inflammatory type or the inflammatory type. So with the non-inflammatory type, you get open and closed comedones, and in the layperson's terms, that would be blackheads and whiteheads. Whereas with inflammatory lesions, these look redder and more severe, all right? So generally, these are papules, pustules, nodules, and cysts. So you can, of course, have a combination of the different types in one person.
Right, okay. And what are the factors that cause acne? As you know, I'm sure that there are certain do's and don'ts for acne. Could you tell us a little bit more about what triggers acne?
So we often think that acne is because of poor hygiene, so parents will sometimes they tell the young daughters, the teenage daughters, go and use a scrub on your face, for instance. But it's not actually due to hygiene per se, So it can be related to your age. We know that it's more common among teenagers, so mainly about the age of 15 to 18 years old, but it can also occur among adults. So adult female acne is a big problem that a lot of us face. So besides that, family history as well, and diet is a factor that a lot of people are looking into these days. So especially things like high glycemic index food, okay, those should be avoided, as well as in certain cases, milk consumption, as well as sweetened food in some studies, but not that the evidence for that is not very conclusive though, as well as certain evidence for lack of fresh fish. So basically, a healthy diet would help to control acne a bit better. So besides that, some people suffer from hormonal problems. All right, in certain women, they get polycystic ovarian syndrome, okay, as well as maybe an androgen secreting tumor or Cushing syndrome. And this can also cause acne. And lastly, sometimes people with oily skin, they can suffer from more severe acne as well.
Wow, that's a very comprehensive summary of all the factors that contribute to acne. So can you tell us a little bit more about whether acne can also affect older people? Because it sounds like acne just predominantly affects teenagers, and they are the ones who are mainly concerned about acne.
Deborah, that's what I thought as well when I was younger. I thought, great, when I get older, I'm going to grow out of this. But unfortunately, I'm still battling acne today.
Oh
I'm not
dear.
that young anymore. All right. So there is a population of adults who continue to get acne. So sometimes it continues from when you were younger and you just don't stop having it, or can also just come and go, or it can occur later in life, say, in your mid-20s, you start getting acne. So those are the types of adult acne that can happen. And there's also an entity called neonatal acne, but that's for a different sort of discussion another day.
Oh, wow, that's very interesting. So what About hygiene, if you say that hygiene is not really a contributory factor to acne, what about the role of antibiotics as well as cleansers? Do they have a role in the treatment of acne?
So we know that for moderate to severe acne, a lot of times we do need antibiotics to treat the patients. But for this sort of thing, it's not just the role of antibiotics to treat an infection per se. You know, it does work against C. acnes as a sort of antibacterial action, but there are also anti-inflammatory effects that we want to tap into in order to treat the acne. So the use of antibiotics such as tetracyclines or doxycyclines, erythromycin, okay, those are mainly used for moderate to severe papulopustular or inflammatory acne vulgaris.
Okay, I
So
see. Wow.
yeah. And in terms of cleansers, so cleansers are also useful, and I personally believe in the role of cleansers a lot. So these actually improve the acne by removing the kind of keratin that hair follicle plugs, all right, and kind of prevent the obstruction of your hair follicles. So we prefer gentle cleansers that are easily rinsed. So not soap, you want to not disrupt your skin pH too much. We would recommend twice daily washing with these kind of cleansers. And these synthetic detergents are very useful, especially those that contain medications such as benzoyl peroxide, glycolic acid, mandelic acid, sulfur and salicylic acid. So those can be very useful. And there are certain cleansers that are even formulated especially for the trunk and back. So those are good for truncal acne.
Wow, okay. That's very useful indeed. Could you let us know whether these sonic cleansing devices actually work? Because there seems to be an abundance of it these days, and they seem to, in the adverts, look very promising to treat and prevent acne. And in fact, I've also bought a very expensive sonic cleanser. I don't know whether my face looks any better. What are your thoughts?
So basically, these products have been marketed for the last few years, and I did have a friend ask me before about these devices. However, there is no actual evidence for the efficacy. So I don't think we can conclude that these things actually work.
Wow, okay, I'm taking notes. So tell me a little bit more about what other effective treatment is available for acne.
So the basic skincare for acne includes your topical products, okay? So that can be used when you have a flare of acne, as well as maintenance when the acne kind of settle down a bit. So never ever forget the role of your topicals, even when you think your acne has, it's under control, it's better. I don't need to use my, topical medications anymore. So that's not true. So a lot of acne patients would require this kind of topical treatment. And these include things like benzoyl peroxide, okay? Brand names would be like Oxy and Benzac, as well as retinoids such as tretinoin and adapalene. And we use particularly a lot of adapalene as it's a little bit better tolerated. And in some patients, we also prescribe antibiotic topically, such as clindamycin and erythromycin. Azelaic acid is also a very useful product, and you can find that online as well as in pharmacies. And this is also useful to reduce post-inflammatory hyperpigmentation, which we get a lot in Asian skin. And the other good thing about azelaic acid is category B in terms of pregnancy. So it's safe for pregnant women. So that's a very useful option if you're pregnant. So other treatments would be like salicylic acid as well as sulfur. And I find sulfur is very useful for the truncal acne and back acne as well. There are a few other products that are not available in Malaysia, newer agents such as Dapsone, testosterone, and olumacostat. So these are not available yet, but they are up and coming treatments. So for more severe cases for acne, however, topical treatment will not be enough. So we've discussed oral antibiotics before this, and those are definitely useful. And other medications that can be used include things like isotretinoin, okay, which is also a retinoid, and it works on all four pathogenesis in terms of your keratin, in terms of your inflammation, your sebum, as well as the C. acnes. So this is a very useful drug for severe papulopustular as well as nodular cystic acne that we use a lot in the dermatology clinic. So for this agent, even though it's really good, it requires certain monitoring, and it's not suitable for patients who want to conceive or who are pregnant as well. And in certain patients, we can also consider oral contraceptive pills, especially if they have some hormonal issues as well, with too much androgen in the body, as well as spironolactone. Certain procedures that patients can also consider when they go to see their doctor comedone extraction, chemical peels. Some people find that it really helps, okay? Things like salicylic acid, glycolic acid, and Jessner solution, as well as TCA peels, azelaic acid peels, IPLs as well.
Ah, okay. Wow. That's very comprehensive. So, of all of this, what do you think is the most beneficial treatment for acne? If you could just summarize the treatment from, let's say, the lowest strength to the highest strength, something in a stepwise approach.
I think if you're talking in terms of a stepwise approach, it's not really a lowest to a highest strength per se, but in terms of what's needed for each individual patient. So we have to assess whether, what sort of lesions you have. Are you having inflammatory lesions or non-inflammatory lesions, and what the severity is? So the basic kind of a product that everyone would need is a kind of topical product. So in terms of retinoids as well as benzoyl peroxide, those are very, very commonly used agents, as well as topical antibiotics. All right, so that should be the baseline for everyone, from mild to even up to moderate or even more severe acne. You can continue it even if you're on systemic agents such as your antibiotics. But if you are someone who's taking isotretinoin and you find it's too drying, you might want to stop the topicals for the time being, because these can, cause your skin to be too dry. So in patients who have the problem of dry skin after acne treatment, you would also need to find a suitable moisturizer which says non-comedogenic, and there are a lot in the market. For instance, like from La Roche-Posay, they're very good, and you need to look out for this word non-comedogenic when you're buying your skincare products. So generally, for more severe cases, then you will need tablets, in terms of your antibiotics, and further to that, even things like your isotretinoin would be very useful. So that's basically the summary of it. And other approaches we can add on as needed, depending on the patient's profile.
So do lasers work in the realm of acne?
So for the past few years, this has been also a very interesting upcoming topic, okay? And lasers have been found to work, not just for acne scars, which we know that a lot of people use it for, but in terms of treating active acne. So we have found things like your 1064 ND-YAG and your erbium glass laser, as well as the pulse dye laser, to be quite useful. And recently, there's also a 1726 nanometer laser that has been reported to be helpful for active acne. So how these devices work is by reducing the size of the sebaceous gland, as well as having a bactericidal, that means killing the bacteria, and this effect on the C. acnes on your skin. So yes, there is definitely a role for laser treatment, and you can consider it if you want to. You have some lesions on your face and you think, I want to target those areas with an appropriate laser.
Okay, and are there any side effects of laser?
So you would want to,
should know about?
Yes. So in terms of laser treatment, even though we say it's promising, however, you can get burning, you can get, there is a possibility of getting post-inflammatory hyperpigmentation as well. And if you get a burn, you can get scarring. So it is possible, but it all depends on which device, and you need to speak to your doctor for further advice.
I see. So could you tell us a little bit more about moisturizers? Are they very important? Because when I had acne as a teenager, I used to skip moisturizers. I always had the belief that they added oil to your skin and that could clog your pores. Could you tell us a little bit more about the importance of moisturizers in acne?
So the thing about moisturizers is a lot of acne treatments, they dry up the skin, because remember, you have a lot of oily skin, your sebum production, and you want to address that with your treatments. So your topical treatment as well as your tablets. However, when you have that and it dries out the skin too much, that might cause problems to you. And therefore, when you select a moisturizer, you have to remember to buy a product that says non-comedogenic. And basically, this means it's not going to clog your pores.
It's very important, yeah.
And you can also nowadays consider moisturizers that contain things like salicylic acid, hyaluronic acid, and glycerin, which may help. However, products to avoid, don't use things with petrolatum. So things like Vaseline, all right, that's not good, because those are greasy and oily. They would add to your problem, as well as coconut oil. So don't use coconut oil if you've got acne-prone skin.
Okay, I see. That's a very useful tip for all our listeners. And another thing, what about sunscreen? Is there a role for sunscreen in people with acne? Will it further clog their pores and make their skin oilier and contribute to exacerbation of acne?
So once again, you have to select a product that is non-comedogenic. So always look for that on the label of whatever you buy. And some patients find that sun exposure worsens acne. And so therefore, there is definitely a role in these people to use an appropriate sunscreen.
Wow, that's very comprehensive indeed. So now I think it's all about finding the right type of topical as well as oral medication if needed in order to treat acne, and also a combination of that plus lasers may help. A little bit more about acne and scarring. A lot of our patients with acne do have what we call post-inflammatory hyperpigmentation, which is a post-acne scarring. And in fact, I did have a lot of that when I was a teenager, but thankfully now you know that I'm older, I've got much less of acne worries. Could you let us know a little bit more about the type of acne scars there are and what are the treatments available to tackle these acne scars?
So basically for acne scars, that's different to hyperpigmentation because in Asian skin, we have pigment, a lot of melanin pigment in our skin. And therefore, if anything disrupts that area in the skin, okay, the pigment can fall through and cause staining on the skin. And that's referred to as post-inflammatory hyperpigmentation. Now, generally, post-inflammatory hyperpigmentation or PIH will go away, with time. All right, it's not something that you really need to worry about. So that's different to scarring, which refers to some injury to the dermis. And in terms of scarring, there are two main types. You can have the raised acne scars, which are hypertrophic or keloid scars, as well as your depressed acne scars, such as your box scar, your rolling, as well as your ice pick scarring. So there are two major types, and the approach will be quite different depending on what you actually have. So for hyperpigmentation, like I said, time is the best healer. All right, you don't have to worry too much about it. Of course, the appearance can be troubling while you're having it. So you can use certain topicals such as azelaic acid and retinoids, as well as hydroquinone to help. Lasers, all right, in terms of use of NDX as well as picosecond lasers, and sunscreen to prevent worsening of the problem. So that would definitely help your hyperpigmentation problem. However, for scarring, it depends on the type. So people with hypertrophy or keloid scars may benefit from steroid injections or even surgery, as well as certain laser treatments that are appropriate, depending on what type of the scar that you're presented with. All right. And some patients also use silicone gels or dressings to help with keloids. All right. But for depressed acne scars, that's a different kind of approach altogether. And you might require procedures such as laser resurfacing. Some people find that radiofrequency or microneedling might help, as well as subcision. If you've got a few scars, in which you use a small needle and you go underneath the tissue to release the scar from surrounding area. Okay, as well as fillers if you've got a few depressed scars. So once again, a very personalized approach is needed after assessing each individual patient.
That's very comprehensive indeed. And another thing that people with acne often complain about is post-acne redness. The scientific term is post-acne erythema, where the skin becomes very red and blotchy, and it can be a bit distressing to certain people. Could you tell us a little bit more about how to manage this and what are the treatment options available for post-acne redness?
So this is a problem that is quite common as well, and it's a bit troubling to a lot of people. So you can consider the use of certain lasers, such as the pulse dye laser, certain NDX lasers as well would help. There are topical treatments available, such as oxymetazoline, tranexamic acid, and brimonidine. However, some of them are not really widely available here. But tranexamic acid, yes, you can find it as a product in Malaysia. So you can try one of those.
Okay, I see. That's very comprehensive indeed, Dr. Kwan. I think that you've provided us an excellent overview about acne, a topic that is dear and near to all of us, and also the treatment options that are available, and also the preventative options that are available, both topically, orally, as well as things like lasers that can help. Would you like to summarize your talk for our listeners?
So the basic thing about treating acne, why is that important? You might think, oh, it's a teenage problem. It's something that's going to go away. But, even if it goes away, there's a possibility that it's going to leave problems like scarring, which will be a long-term complication of your active acne. So it's important, if you are suffering from acne or if someone you know is suffering from acne, get it addressed and get it treated early so that you do not have to deal with the scarring at the end of the day, which is a very big problem, and it causes a lot of complications to your life, and it's also difficult to treat. So so treating is important, treating early, treating effectively in order to get the best outcome for your acne.
That's great. And I'm sure if any of our listeners have any questions or need a consult regarding their acne, you are just email away.
Yes, and you can also go to our website and there'll be a contact available if you need any further advice. Once again, as we always say, medic experts, we're here to give you the information, but it's not personalized. So if you need a consult, you have to see your doctor and get something specific for yourself.
So thank you so much, Dr. Kwan, for taking time to educate all our listeners a little bit more about acne, its trigger factors, and its treatment and management. I think all our listeners have an insightful time, and now they are equipped with knowledge how to handle acne. So we look forward again to our upcoming podcast. So stay tuned, and Medic Experts are here to bring you solutions to your healthcare problems. Thank you, our listeners, and see you again. Goodbye.
Thank you and goodbye.